It's 2:03 and I really do like to be on time and start on time as much as possible. So I just want to thank everyone for coming out. This is the Health and Human Services Committee, Subcommittee of the Springfield City Council. And for those of you that might not know, I think everybody probably does, I am City Councilor Zeta Govan. So I just want to, again, thank everyone for coming. And the agenda, I can't find it, but I know that the Mental Health Committee report is on the agenda, which I'm really excited about. I hope that everyone was able to get a copy of it. There's an edit that we have to make on here because on the flyer that for the mental health check-ins, we did leave the BHN logo out, and I have to make sure that it's included in that. So I'm going to make an amendment and make sure that that gets in there because for some reason it was left out. But again, I think it was a pretty comprehensive report. It was a matter of us meeting about 6 times last year, where Marcus Williams, the then City Council President, appointed me as the chair of that committee. And I was honored to be able to follow through and come up with a report. It's pretty comprehensive, and I don't know that it's anything that we didn't already know. Healthcare professionals, that there's not enough resources, not enough services, and that there are a lot of people in need. So that's I think the gist of that report. Are there any comments, or does anyone want to comment or have any questions about it?
Zeta, would you be able to share that in the chat by chance?
Let me see if I can. I should be able to. It's I could actually email it. Did Paul get it at
I'm not sure. He sent me the link to the meeting, but he may have it.
He just sent the link. Okay.
I'll check with him before
Yeah, I'll certainly send you the full report if you'd like. If you want, put your email in the chat and I'll send it to you right now, actually.
Thank you, Zeta.
You're welcome. Great.
Speaking on behalf of CHD, I haven't had a chance to digest the full report, but I just wanted to express thanks and congratulations to the folks who really put the spotlight on this important subject that is not only growing more important seemingly as we see the epidemiological data about prevalence of mental health challenges, particularly among young people and young women. The work is getting bigger and harder, but I think the other good thing that's happening is we have a pretty good resource picture in Massachusetts for the first time in a long time, and more resources coming into mental health. I know our agency started implementing our CBHC model just up the road in Chicopee, Holyoke, that area on January 3rd. And there's been a lot of really positive early findings from that. So hopefully the folks who are working on the new community behavioral health centers across the state and certainly here in Springfield are really seeing progress in access to care. I think the same day access or urgent access is going to be a big difference maker for folks. And again, I just wanted to express my admiration and appreciation to the folks in our local leadership delegation and the city government who have put this appropriate focus on the topic. Thank you very much.
Thank you, Ben. And I also want to thank CHD. And if you wouldn't mind, Ben, talking a little bit more about the community behavioral health centers that are running. I know that BHN has one and you guys have one over at CHD. I'm really excited about that. I'm sending a lot of people your way. How exactly could someone access it? I think it's very important that we know, especially as leaders in our community, how to direct people that way.
Yeah, sure. I'll talk briefly, and I have to apologize. I have to go to interview a candidate at 2:30, so I'm going to be brief here today. But yeah, so the state, it's really part of the redesign of behavioral health services delivery, and particularly on the urgent care and what had been known as ESP, mobile crisis response. for urgent care, and the state designated different catchment areas. And you're right, BHN, which obviously has long had a presence in Springfield, will have their CBHC in that area. We're in the Chicopee, Holyoke, west out into the rural towns of Ware, Palmer, and Munson, and everything in between. And really, it's the idea is that there's one door for services for everything related to community behavioral health, whether it's urgent care, mobile crisis response. I know we're working very closely with police departments in all those cities and towns to provide mental health resources where they're needed, and recognizing that police officers have a job to do, an important one, and in some instances they should be the first responder. In other instances, having mental health resources available either immediately or quickly is a real difference maker. So that's been a very good partnership for us. We're working closely with the schools, we're working closely with the primary care network and with hospitals. And I have to tell you, this is very anecdotal, but in our first week of operation, we had a young person come in for services, and after the intervention, their mother came and wrapped her arms around one of our providers and said, "Thank you for finally giving us a place to go." Which was very powerful for them. And I think, it's not going to be perfect. It's not a magic solution for all ills, but the model seems to be working, at least so far. And people are getting services, and, we hope it continues to grow and be successful, in all the communities where it's being implemented. We were one of only 2 that got open in January, which we were proud about. It was an enormous amount of work and stress. But we were proud to get the doors open, and I think we're already learning a lot. So hopefully it will be a successful model. And, obviously, most importantly, not what people like me say, but the experience of folks who are getting the services. And hopefully it continues to be a positive one, and we can have, more resources around for the long term. So thanks again. Really, I haven't played a big role here, but I did look at the report. It looks like there's a lot of good stuff in there. So thank you again, and congratulations.
And thank you. And I believe that CHD was at the table in the last year. So I appreciate your input and your participation as well.
Thank you.
And you said the youth are vital in this struggle, right? Because I'm finding out as a private clinician that the youth have been extraordinarily affected by the pandemic, and they were isolated for a while. They weren't developing socially, and then all of a sudden they came back, and now the world is open again and they don't know how to act. So there's a lot of anxiety, a lot of depression. So I'm really excited that the Youth Mental Health Coalition was able to also participate in the year-long, I'm going to call it a study, but it was just a set of meetings that we did to collaborate, because I'm always big on collaboration. Tiffany, thank you so much for being here and for being an integral part of the Youth Mental Health Coalition and bringing those kind of resources and information to our youth, which is absolutely necessary. So thank you all. Again, I don't know, Tiffany, I was just saying that the report that came out, it's public. We can, disseminate it out. There is an edit that I need to make on the mental health checkup flyer, but we'll do that, and then we'll send the amended edit out. Any other questions or comments about that? The report? Or I know there's a lot of stuff going on. Tiffany, you have a lot of stuff going on with the Youth Mental Health Coalition. And I'm just excited about what the city of Springfield is going to be doing to help our residents access mental health care, young and old alike, because right now there's a need everywhere. So I'm excited about that. Speaking of which, the next item on the agenda was the Alzheimer's Association. However, I don't think that they got the link to the meeting, because I just got a text from Z saying that she didn't receive the link. So I might actually just, if it's okay with you, Ms. Helen, schedule a specific meeting for the Alzheimer's Association to come and talk to us, because they have a really exciting program that they want to offer to first responders, to everyone who is working with seniors and people who might be affected by Alzheimer's and dementia, to provide some really great information. Ms. Helen, did you want to say,
No, I apologize. I meant to jump in and just congratulate you and the committee for amazing work. I think we all know the challenges that are experienced across the city in all ages around mental health and mental health disorders, particularly as we look at communities of color and culturally appropriate I'm going to call them technicians, but clinicians who are available in order to assist. So I just want to start and thank you for your work. And I know that Sandy is on the call as well, but we are happy to meet with the Alzheimer's Association. We have participated every year in their events, and we're happy to do that again. So let me start with the committee. Thank you, and then end with absolutely we can participate.
Excellent, thank you. And thank you so much, Ms. Helen. As I wrote in the report, this is an effort of love, I think, on many different parts. You know, everyone who participated in the meetings, Ayanna Crawford was a big help. Aurelis Barbosa, who just came on at the tail end and just started working, Teresa Glenn from your office, everyone was amazing, you know, and I truly appreciate it. And I feel like it is evidence of what can happen when we all get together and when we work together. So I'm just really excited about that. Thank you so much. Sandy, I don't know if you wanted to talk about the item on the agenda. Let me see.
With reference to the Alzheimer's, certainly. I echo Commissioner Carlton Harris's agreement to meet. I you know, and I've mentioned this to you before, that anytime we can partner with anyone who shares the same passion and heart, we just strengthen our course, so to speak. We are seeing since COVID a tremendous amount of changes in personality on a daily basis, to the point where we're becoming concerned. So I'd be very interested to hear what the Alzheimer's Association has to say with regard to how we can help these folks, any presentations we can do to a larger population. Many of our seniors are now living with their children, so the dynamic is changing, and so we're trying to get a handle on it. And sometimes you feel lost and floundering because you can't, it just never happens fast enough for us. And so I feel like you and your team and all the work you've done have kind of sent us all a life preserver of sorts, that we can cling to if needed. So I'm always hopeful and looking forward, as opposed to hanging on to the past. So we're looking to make some changes.
Okay, great. Well, thank you so much. I know that the Alzheimer's Association's Z Johnson was on that, and I forgot the other woman's name, but they want to do an Alzheimer's Association dementia training for first responders, for anyone who is interacting, like I said, with the seniors and who may be affected by dementia or Alzheimer's. So what I'm going to do, if it's okay with everyone here, I'm going to set up another Health and Human Services Committee meeting and invite them to come in and do their presentation. They really want to reach out to police officers, maybe first responders as far as crisis, mental health clinicians who are responding, especially probably in the behavioral health community centers, that I think they would be able to use the information to appropriately address the issues that they're presented with out in the community. So I think I'm going to do that, and we'll probably do that sometime next week or the week after, because I know our schedules sometimes conflict. So we want to find a good date for everybody. Okay, great. And I won't keep you long. I believe time is so important to us. So again, I want to thank you all for coming out. Sarah, thank you for coming and representing Choice Recovery Coaching. Ayana, thank you for being here. And I look forward to seeing you all again in a couple of weeks. Have a great day.
Thank you.
All right, bye-bye.
Bye.